Well, you think it's springtime, right? The flu season is all but over. But there is something going around filling up emergency rooms around Metro Detroit, and it's the stomach flu, and our little ones are getting it. So what's going on? We're going to check in with Dr. Kelly Lavasser with Beaumont Children's Hospital. Doctor, thank you for joining us.
Thank you for having me.
So it is the little ones who are being most affected, right?
It is the little ones, especially children between the ages of about 6 months to maybe about 10 or 12 years of age, because after that, kids start to wash their hands a little bit more, so they're not quite as affected as the little kids.
And what is this? I mean, what is behind this?
So it's one of many viruses that we have in the community, and for whatever reason, this year it just seems to be the virus is a little bit more maybe strong than it has been in other years, because the stomach flu this year, in the past it's lasted maybe 2 or 3 days where the kids have had vomiting or diarrhea, and this year it's really lasting maybe 4 or 5, even 6 days.
And those are the symptoms, the vomiting, the diarrhea. What about temperature, anything like that?
They don't necessarily have to have a fever. Some do. Some are having a fever this year, some aren't, but really it's just the vomiting and diarrhea, and some are having stomach pain along with it as well.
So when do you take them to the ER?
That's a great question, and that's something that I try to talk to all of the parents about when they bring their kids in with vomiting and diarrhea. When to come in and see us. So if your child is having vomiting and diarrhea, one of the most important things to look for are signs of dehydration. So if your child hasn't peed for like 10 to 12 hours and they are just laying around and they're not really acting like themselves, they could be dehydrated, and so they need to come in and see us, and they may need an IV and have IV fluids.
Oh, and is this the big one, or are you seeing other viruses coming through your doors?
We are seeing a lot of the stomach flu, but we're also seeing a lot of fevers and coughs and just some other viruses that are going around in the community. But again, a lot is the vomiting and diarrhea.
So, Doctor, the biggies are hand washing. That's a huge one, right? And what else can we do to keep our kids from getting sick?
So just make sure that the kids themselves are not sharing drinks, sharing juice boxes, sharing the eating utensils, whatever they're using, to try to stop the spread of this.
It's so hard because one picks it up, one puts it down, and well, yes.
I've had families come in, they have 4 kids in the family, and it just goes through one by one by one. So it's tough.
Let's hope we can get it out of there. And Doctor, thank you for your tips. We appreciate you.
Thank you so much. Have a great day.
Okay, over to you, Brad.